After 2 years of lockdowns and social distancing, the flu has returned with a vengeance. New South Wales has become the latest state to announce free flu vaccines to try to head off a horror winter season. But it's not just New South Wales dealing with a surge in cases. These are the national lab-confirmed cases of the flu from 2017 to 2019. As you can see, 2017 was one of the worst seasons on record. It resulted in 29,000 hospital admissions and 745 deaths across the country. But when the pandemic arrived, the flu all but disappeared as lockdowns forced people to limit their movement. You can see the number of cases barely registered on the graph in 2020 and 2021. But this year, it's a different story. The easing of COVID restrictions has brought people back out, leading to a surge in flu cases. And now health authorities are pleading with Australians to get a flu shot to ease the growing pressure on hospitals.
We've got this issue that there's relative complacency about both the flu and COVID, and we are careering into our first proper flu season for 3 years with 3,000 people in hospital with COVID at the same time. So really it's a signal to everybody, look, we've got to take this seriously.
Queensland, New South Wales, South Australia and Western Australia all offering free flu shots to everyone until the end of June. In Tasmania, free shots are available at certain state clinics. Victoria and the Northern Territory are seriously considering making the vaccine free as well, with reports that Victoria will announce the move later this week, while in the ACT it remains free only for certain vulnerable groups. Doctors are calling for patience as more people become eligible, especially in New South Wales.
If you're seeing your GP for something else, then that's a great time to get your flu shot. I think the main thing is the next couple of days, both for GPs and pharmacies, just give them a chance to get going because this announcement has just happened. So be wary of just ringing both the GPs and the pharmacists up just today because it's going to be full on again. Every time we've had an announcement about some change to the flu vaccine, our receptionists get inundated. So we just need to cut them a break in the first couple of days or so.
Flu shots are recommended every year. We actually don't have particularly good uptake in the general sort of population on an average year. And so this year, I think they're really seeing that there's going to be a big hit on the healthcare system. The healthcare system's already stressed from 2 years of dealing with a pandemic. And of course, we know COVID cases are high at the moment as well. So it's really important. Cost is a factor for people, but there's also other things that we know that can help people access them even more easily, like workplace health programs where the vaccinators come straight to the workplace, basically just removing as many barriers as possible to help people to access them. And importantly, remembering that the at-risk groups for flu are similar but slightly different to that for COVID-19. It's more likely to be severe in young kids, and typically young kids have a very, very low uptake of the flu shot, but this year they're really urging it.
You think also there's an element of vaccination fatigue at work here after COVID?
I think that's probably fair. I've heard experts say that, and who am I to argue with them? Me, always looking for a silver lining, hopes that perhaps we're more aware of dealing with respiratory illnesses before than we ever were before because of this pandemic that we've just had, and we can see how effective vaccination strategies can be. We know it's possible to vaccinate huge amounts of the population if we really have the will to do it. So yes, while we're seeing people saying that vaccine fatigue is a thing, I hope that it actually helps galvanise people to go out and get it. And then the other thing that I think was a little confusing at first when vaccines from COVID were first being rolled out is that they were recommending that people have a bit of a break between those two vaccines, whereas now they're saying you can get them at the same time. So you don't need to book two different appointments. You can get them on the same day if need be.
Is this year's strain of the flu a nasty one, Tegan?
I don't know if it's any worse than any other flu strain, not being a virologist myself. It's not a pandemic virus of flu. We do see that pop up from time to time. The great news about this year's flu, if there is such a thing, is that it is a good match for the vaccine that we've been given. So every year scientists are trying to figure out which are going to be the circulating strains, and they pick the top 4 to put into that year's flu vaccine. And so far, well over 90% of the cases that have been detected are a match for one of the strains that's in the vaccine, or 2 of the strains that are in the vaccine. And so that's a good sign that they've backed a winner with this year's vaccine. So it shouldn't be a nasty one if you're protected because because just like with the COVID shots, the flu vaccine, it might not stop you from catching it entirely, but it does dramatically reduce your risk of severe disease.
Okay. Meanwhile, COVID cases are still very high in Australia. Per capita, we have one of the highest rates in the world at the moment. What's going on?
Yeah. It's frying pans and fires come to mind. So yes, we had heavy restrictions the last couple of years. We have lifted those, and the cases have definitely increased. With comparing per capita internationally, it's tricky because it really depends on what's being reported in those other countries. So yes, there's no doubt that there's huge amounts of COVID around at the moment, and we shouldn't dismiss that at all. But also, it shows that there's good surveillance in Australia, and possibly overseas, there's places where the reporting isn't as strict. Perhaps there's more fatigue around people getting tested and then reporting the results of those tests. So international comparisons need to be taken with a pinch of salt, but there definitely is a lot of COVID around, and we've shown that we know how to suppress it. Not saying that we need to go back to strict lockdowns and that sort of thing, but things like social distancing, masks, good ventilation, and of course vaccination all help reduce the risk.